Hi, my name is Farah and this is Shaz. We are both clinical psychologists from Mental Health Venue and We Care Light Health Center. So today we have one of our COVID-19 series talks. And would you like to share what is the topic of the day?
Okay, so today's topic is coping with anxiety. Okay, so today it's gonna be mostly about those who have a mental health problem, who may have a disorder, anxiety disorder. And so we're gonna talk about how you're gonna manage this anxiety symptoms during this difficult time. All right, so every now and then everybody feels anxious, and it's normal for all of us, but those who have anxiety disorders is different from them because it is something that actually stops them from actually carrying a normal life, and it makes them a little bit more dysfunctional than others. So it is a little bit more severe compared to the normal person.
Yeah.
Right?
So the worries are more and then probably more elevated, and I think worse. Worse.
It definitely is more generally. It is very overwhelming. It causes them to only constantly think about the thing that is worrying them, and
definitely something we do have something to worry about because it's it's a pandemic right now. So here's gonna talk about some tips that actually can help individuals with anxiety problems during pandemic.
Yes. Okay. So number one, that would mean we should try to avoid health-related news. What I mean here is that because every hour there's some kind of update that is going on, and we tend to look at our phones and we want to know what's going on. But those who do have anxiety issues, it is best that you stay away from this type of news. I'm not saying totally stay away, but I'm saying that maybe you just have a time frame where you actually check the news, and
or select what type of news you want to take.
Yeah, select what type of news you want to take. Or what you could do is you can tell your friend or your family to actually update you on what is important for you to know.
What you need to know.
Yes, what you need to know, so that you do not go constantly look at the news and start worrying about what's going to happen.
Yeah,
right?
Definitely. So number two is, obviously when we talk about a pandemic, you talk about, do I have it? Do I not have it? What's the symptoms of, like the disease that's going on right now, which is coronavirus. So I would say if you really need to go and find out about it, get it from a reputable source or an official source like KKM. Because if you go and read other things, you may get misinformation or you might get overloaded, and that's not a good thing for you.
Alright, yeah. So number three is that what we would like you to do is probably practice this at home, which is perhaps it's a little bit difficult, but it's something that you need to do so that it stays under control, anxiety symptoms. One, it is to counter your thoughts. Because when you have a persistent anxiety or fear, you need to challenge your thoughts, and this means that you may have thoughts such as everyone I love will die from this virus, perhaps, and you can counter it by saying with factual statements where you can actually look at the evidence that says that most people who do get COVID-19 will recover fully, and that means that my loved ones will also recover from it, right?
Yeah, so it's quite helpful to actually take control of the situation in that way. So number four, another way you could do is to distract yourself from what's going on, from the current situation. For example, maybe some things we can't change, something is just happening, so what we can do is distract our thoughts, such as watching a TV series, watching movies, listening to music, meditation, whatever it is that makes you
happy
and distracts you from that particular thought, right? Yeah.
Number five is to do some exercise. What it would do is to get you to do something else. Number one, distract you, like just what she said, and other than that, it would also get the adrenaline out of you, and
it makes you healthier, which less likely to get,
and you will be channeling the panic to something else. Alright, so maybe just jump around your bedroom and dance a little, or do whatever that makes
let it out. So we talked about 5 tips. So if these 5 tips you feel is not helping you, so what you can do is you can find other ways to actually get help. For example, we are actually
offering e-therapy services
in our center, so you can just give us a call for the rates and for the appointment.
Alright,
so see you later.
Bye.
Bye.